Hi, this is Dr. Bob Dannenhoffer with another Facebook Live events tonight. So you'll see a little difference tonight. We're in a different studio here because the lights are out in downtown Roseburg. So we're improvising tonight. And so if it's not exactly quite as smooth as it normally is, we'll blame it on the power outage. Anyway, as always, I always try out new masks. This is a mask my wife made for me. I especially like it. It's somewhat fashionable, it works beautiful, safe to use, and it really doesn't make a difference what kind of face covering you use. Just please use a face covering. I'm going to take it down now so that people who read lips can do better. Again, Dr. Bob Dannenhoffer, Public Health Officer from Douglas County. It is the 28th of August today. It is very hard to believe summer is almost over. This pandemic has really made time fly. Well, anyway, tonight is a chance for you to ask questions. Put them in the chat section of Facebook. As long as the power holds out, we will go ahead and continue. You can hear a little bit of beeping in the background, and that little bit of beeping is from our power meters. Anyway, so as always, we'll start off at the top and then move down. In the world, we're going to hit 25 million cases today and 838,000 deaths. So this is still a very brisk pandemic in the world, still very active in the US, still very active in Brazil, and especially active in India. And again, India is a big concern, such a big country, such a populous country, and they're really not doing a lot of testing. So there may be even much more illness than we know. In the US, we're also going to probably hit 6 million cases and 185,000 deaths today. So very active in California, Texas, and Florida, and especially active now in North and South Dakota, Georgia, and North Carolina. You remember a few weeks ago they had the Sturgis motorcycle rally in South Dakota, and they've really seen a lot of cases. So I see yesterday they had 633 cases in South Dakota. That's a lot of cases, especially when South Dakota only has a population of less than 1 million. I mean, that would be like Oregon having 2,500 cases in a single day. So lots and lots of cases. Oregon, unfortunately, is pretty stagnant at 200 to 300 cases a day. We really should be working on bringing that down lower. The good news is Douglas County is very quiet. For the last 2 weeks, we had less than 10 cases in the entire week. And it looks like this week we're on track to have the same low amount of cases. We actually went 3 days earlier this week with no cases at all. So in Douglas County, we're doing well. The reason we want to be doing well is if we can bring that case rate down and keep it down, we can open all the schools. Right now we're at a rate where we could certainly open K-3, we could open remote and rural schools, and we can open special education. But we're not quite at a time where we could open all the schools, and that's really got to be our goal. So there's lots of great stuff out there. Please send in questions. We have our question people in the semi-darkness here doing it, and hopefully you can see it well. Lots of new stuff that's come out about the vaccines. The new stuff on the vaccines suggests that the vaccines seem so far to be working pretty well. They're in phase 3 trials. Again, these phase 3 trials are trials that use a lot of people, about 30,000 in each study, and then they have some who get the placebo, some get the active disease. And in these phase 3 trials, we look for rare side effects that you may not have seen in the small phase 1 and phase 2 trials. Second is they expanded to larger population groups and people with underlying conditions. That is the people who are most likely to get the disease. And then they also look to see how well it works, comparing people who got the vaccine versus the people who got placebo. And so these phase 3 trials should show a lot. All right, questions here. So what about masks that rest on your chin? What do you think about those? Again, we think that the biggest use of the mask is to prevent the spray of droplets. So to prevent the spray of droplets, it needs to cover your mouth and nose where the droplets are coming from, plus a wide distance. I really like this mask in that it goes right over the nose and under the chin and probably blocks most of those. I've seen some of these face shields here that are really tiny, and they're probably not doing nearly the amount of blocking that we want. Yeah, so Veronica says, why is Rite Aid having people do their own test? I wouldn't think it would be as accurate. I doubt people would go deep enough. The test that Rite Aid is using is approved for use in the front part of the nose. You're right, it's not quite as accurate as tests done deep in the nose, but they're still pretty accurate. And the advantage of those tests is that people are much more likely to volunteer for those, at least the second time, than they would be with the deep nasopharyngeal swab. So there is a trade-off there, a little bit better acceptability versus a slightly lower sensitivity. So someone says, if in general masks work, why are numbers still growing? Well, the numbers aren't still growing in Oregon. As I said, the numbers have been flat. The numbers in Douglas County are down, and the numbers in areas where people have been using masks are down. In the places where people are not using masks well, like the motorcycle rally, like some southern states, like some college campuses, the numbers really are growing. I think actually over the last month, the data on the masks has been borne out by the fact that the big places we've been seeing the biggest increases are the places where the masks are being used less and less. Okay, a couple of things. I did, over this last week, I asked our staff to contact the first 20 people who had COVID in Douglas County. So these people had COVID in February and March, and we talked to them to see how they were doing. So of the 20 or so people we got hold of most, but not all of them. And what we heard from them was really pretty striking. Something less than a quarter of them feel that they're 100% back to normal. Most of them were sick for a week or two and got back to normal, of the ones who are well. Of the 3/4 who are not back to normal, people are still having a lot of symptoms. Cough, diarrhea, shortness of breath, and memory issues. We have one person who's still on oxygen, and we have one person who's still in rehab. We have people who have all kinds of long-term symptoms from this. And so they've come up with a name for the people who have long-term symptoms called long haulers. And these people in Douglas County very much fit that pattern, that now more than 100 days after their illness, they're still not nearly back to normal. And I talked to a young woman today who had the disease, and she said still after 2 weeks she feels gross. So anybody who says, oh, this is just like a little cold, don't worry, you'll get over it, that's certainly not been the experience of the people we've seen. Sandy said, is there any way to find out how many of the state case count are presumptive? Yeah, we make it easy to figure out the presumptives. I will tell you, it is a complicated, it's complicated to do, because what happens is some people go straight from nothing to a confirmed case. Most people go from nothing to a presumed case. That is, they have the symptoms, they're awaiting a test, they're presumptive, and then that test turns positive, so then they go from presumptive to confirmed. So we have a small enough cases and a big enough staff that we're able to calculate this every day. It's actually a very complicated calculation, and the state isn't doing it. But I think when I look at the state numbers, I would think that their number of presumptives is about the same as ours, 10 to 15% of the total. And again, I think most presumptives probably have the disease. And there are a lot of people who we think probably have the disease that never get counted. So for example, somebody who had an illness in March said, boy, I was pretty sure I had the disease, and then have a positive antibody test, they never get counted. Hi, this is Dr. Bob Dannenhoffer with part 2 of our thing tonight. You know, we've had a little mishaps along the way where power has gone out. There was one where we turned the phone sideways and I was sideways for a bit, but we persevere. So today the power went out in Douglas County, and now we're doing it in another room here where there's natural light. We just had to put up a mobile hotspot so this works. So please excuse us for our technical glitches, but you know what? We persevere. So I was last time talking about the presumptives And somebody's saying that the presumptives at Mercy said they had no symptoms. They indeed had symptoms. And it can't just be mild symptoms like a headache or a sore throat. It has to be one of the 4 cardinal ones, which are fever, shortness of breath, cough, and change in smell. And the question is, why don't they deduct the Mercy negative tests? We've done this again and again and again. So most presumptives really have the disease. There will be an occasional presumptive case that maybe doesn't have the disease. Maybe they've got something else that looks like COVID. That could happen. But in the end, it really doesn't change anything. Whether we had 173 or 171 cases really doesn't change a lot. We really need to get past this. Somebody says Douglas County e-government website has not shown the daily press release for 2 days. I've seen it, but I don't usually look at it on the website. So we'll check to see what's up with that. So Kathy says, if PPE works, why are doctors and nurses getting COVID? Well, people who work in the healthcare field get it about the same rate as others. And we think that most of the cases in healthcare actually aren't acquired in healthcare. It's acquired at home or the other kind of things that people do. So actually, PPE probably does work. We have seen very few cases in the hospital where people caring for a COVID patient then get COVID. So I think it really does work. Somebody says, what are the OTC recommendations with mild cold symptoms? Well, there's nothing that really truly works for colds other than time. Almost everybody has their own little thing that they like. Ibuprofen, Tylenol. For older people, you can use aspirin, honey, lemon, Ricola cough drops, NyQuil. You can use all of those things. Nothing really works to get rid of the cold, but if you think it helps you with your symptoms, go ahead and do it. When I was a kid, my mom loved Vicks Vapor Rub, and I still hate the smell of that today because it makes me feel sick. So how long do the vaccines remain in the phase 3 trials? Are we looking at months before it's ready? And I think we are. So for phase 3 trials, what you're looking at is side effects. And typically you're looking at side effects for the first 30 to 60 days, so it has to be at least that long. And then you're going to look for efficacy. And efficacy means what is the difference in the rate of the disease in the people who got the vaccine and the people who didn't. Douglas County would not be a good place to do a vaccine trial because the chance of you getting the disease here with or without the vaccine would be low. And the problem is going to be they may not have enough exposures in the people who got the vaccine to know. I think the most likely thing we're going to have is that these vaccines are going to get approved sometime around the first of the year. So governor suggestions, I've been looking at them. We've had a couple of good governor suggestions. One was to have a town hall. I don't think I can do that with the governor, although we may try to do one locally. One was that people should keep a daily log of where they have been and who they've had contact with. That is great. So keeping a daily log of where you've been and who you've had contact with is great, and I kind of do that. But what I try really hard is to have a list that says, my wife. And that's the only contact I have for the day. So I try really hard that when I'm going out and whatever, that I always maintain social distance, and that at times when I cannot maintain social distance, wear a mask, and to limit the length of my exposures. So again, short exposures so much less risky than long exposures. And so we think that the cutoff line is around 15 minutes. So I go whole days and weeks without any exposure except my wife. So Justin says, why aren't more places testing the sewage for COVID? Yeah. So this is a fascinating thing. So there is COVID RNA in people's feces. RNA is pretty darn durable. And so you go to the bathroom, it goes through the sewage system, and it winds up in the sewage. And you can actually look at the combined sewage for an area, city or wherever else, and find out how much RNA is in the sewage. and by that calculate about how much RNA there is in the population. And when people first said that, everybody scoffed. They said, really, that long travel from your bottom through the sewage system to there, that's never going to work. But indeed it does. And so you can definitely look at sewage and see how it goes. Oregon is looking at sewage kind of randomly rather than in a systematic way, although there are some of us who really think that would be incredible if we could do it and see. In the places where we've looked in Oregon, the sewage levels actually have correlated with the amount of disease in the community. It really is fascinating. Sewage testing is amazing for other things too. So you might, for example, be able to find other diseases. On a positive note in the world, polio was eradicated, wild polio was eradicated from Africa this year. And the way they look at that is by looking at sewage. So does Mercy employees still have it? I don't think I can give individual things, but all of the Mercy people are past their infectious period. So Ralph says, how is Douglas County affected by the revised CDC guidelines for testing and travel? Oh my goodness! Talk about badly done. This has been so back and forth over the week about what's going on with the CDC recommendations for testing and pre-travel testing. So I think what came out of it was that, look, you don't need to test every asymptomatic person, and asymptomatic testing before travel is not necessarily your best strategy. That's stuff we've been saying for a long time here in Oregon. We try and test everybody who wants a test. So there's some people who are asymptomatic contacts who don't want to test. We're not going to force you to do it. The people who just want to have a test because they want to have a test, get a test. And so, unfortunately, the CDC went back and forth and back and forth. There was suggestion there was some political influence. This is really terribly embarrassing from public health. CDC for many years was seen kind of as the go-to people for advice. And sadly, during this, they've not been. So are we testing exposed non-symptomatic folks despite the CDC advice? The answer is we are testing anybody who wants to get a test. We do recommend that asymptomatic close contacts get tested just so they can know. Now, it doesn't change their quarantine. It doesn't change a lot that what we do. But if people want to get tested, we certainly want them to get tested. So for Anna says, long exposures, would that happen in a school? Absolutely. And so what we know is going to happen in school is that because kids are going to be in class with each other for at least 30 minutes, and in the younger grades for hours and hours and hours, we're going to assume that everybody in the classroom has been exposed if they're in the classroom for more than 15 minutes, and that's going to be basically everyone. And so that's the cohorting deal that we're going to deal with schools. So if we have a class of 20, say in a second grade class, if one of the kids or the teacher has it, we're going to assume that everybody has been exposed. Yeah, so Debbie says, aren't the high numbers in Jackson County concerning for Josephine County and Douglas County considering the close proximity? Absolutely. I was on the phone for about an hour yesterday with the people from Jackson County, and they are just throwing up their hands, having a lot of cases related to workplace outbreaks, and they're going to have a hard time getting under control. The good news is that there's not a lot of cross-pollination between the workplaces in Jackson County and here as of yet. What we do worry about is that when the grape harvest starts, people who are seasonal workers will come into the community, and we are worried that we could have a spread then. So what we want to do is keep the rate of disease just as low as possible. So Crystal says, do you think the state is doing well enough that we will not see restrictions on restaurants and bars, any travel restrictions soon? Certainly Douglas County is doing well enough that we're not going to see any of those things. I don't think we're going to go backslide unless something really terrible happens. I don't think we're going to backslide in any of those areas. There are places in the state that are really not doing so well. I think the Marion Polk County has really struggled. Certainly Umatilla and Malheur counties have really struggled. So there may be more restrictions there, but I think we're doing pretty well here. So Anna says, aren't there more and more kids getting COVID around the U.S.? And there does seem to be. The American Academy of Pediatrics put out a piece talking about the number of cases in kids, and it really has gone up. And in fact, it's gone up a lot for us. So when we looked at our original cases were mostly adults, almost all adults, and they were mostly older adults, and they were mostly older adults who had traveled. So somebody who traveled to Tennessee, and I keep forgetting Tennessee is one of the cases. Tennessee, they traveled to California, they did international travel, and then they came back with the disease. Over the last month or so, we've seen more people in their 20s and 30s. We actually didn't have any teens until about 6 weeks ago, and now we've had a bunch of teens, and now we've had kids as young as 6. So yes, I think there's more disease in younger people. Some of it is that we're doing more testing, so I think that's it. But I think the disease is also spreading as young people are getting more active and doing other kinds of spreading things. So we've seen, people traveling to other states for family reunions, and that we think is the big risk. Posted on our Facebook page this week is a YouTube video that I did looking at Douglas County comparing to several other counties. Certainly lots of criticism about that, but I think what it shows is that Douglas County has had a blessedly low number of cases and deaths and a slightly higher economic impact than the other areas. And so I'd encourage you to look at that. I also looked today at the whole country. There are 77 counties in the country that have between 100 and 125,000 people, just bracketing Douglas County. In those counties, the average number of deaths is 32. Ours is 2. Of those 77 counties, there are only 3 counties with lower death rates than Douglas County, and those are 2 counties in New York that has had really strict restrictions, and a county in Wisconsin that's also had strict restrictions. So when you look at these and look to see how these places have done, it pretty much follows that the places that have had more restrictions have had fewer deaths. The places that had the fewer restrictions have had more deaths. And so this is a balance, right? Because the more restrictions you have, the more economic impact it has, the more impact on other things it has, and maybe fewer deaths. On the other hand, doing less, you may have less economic impact, but more deaths. And that's a hard one to balance because it's always hard to know how to balance deaths and the economy. So I'd encourage you to look at that video. And the power just came back on. Yay! Anyway, let's see. We have more questions. We had a little break up here, a little break in the when it came on, but the power is coming back on, which is a good thing. So while we're waiting for that, let me just tell you about some new data that's come out. So new data that's come out about new therapeutics. One of those is convalescent plasma. And so I listened to three podcasts about convalescent plasma this week. And I think the 3 podcasts are the convalescent plasma appears to be really quite safe, but not particularly that effective. We were thinking this was going to be just boffo. You give it to somebody who's sick, they turn around and get better. Hasn't shown to be the case. The second one, you'll remember about 6 weeks ago, there was this guy from Texas who talked about inhaled budesonide. It's been looked at again and still does not appear to be the magic that he thought it was. And then the other one is this thing, which I think is very exciting, which is called a monoclonal antibody. And what a monoclonal antibody is an antibody a human antibody that gets reproduced in the lab and then gets given to people in concentrated amounts as soon as they get exposed to the disease. That to me, I think, may be the most exciting way to do it, because this is how we deal with other diseases. So let's say you have somebody who's not been immunized against tetanus and they get a dirty wound. You can give them something called tetanus immune globulin, or TIG, and it really does prevent the disease. Babies get botulism, and there's a thing you give them called baby big, botulism immune globulin, and they really are fairly magical in the way they work, and that's my hope, that monoclonal antibodies will come out. The problem with monoclonal antibodies, they are darn hard to make and very expensive to make. And so they wouldn't be something I think that you could do for everyone, but for really high-risk populations like in a nursing home, they could be great. Okay, a few more questions here. So if daycares are okay to be open, why not schools? Well, again, daycares stayed open because of emergency use stuff, and they're allowed to open. K3 can open. Now, we do know that as kids hit 10 years of age or so, they become much, much, much more efficient spreaders of the disease. And so that's why there's more restrictions on kids above age 10, grade 4, than there is K3. So I think all the K3s can open. And I saw in the newspaper the other day that Days Creek did. So Zach says, Rhinovirus, can you explain what it is and why it can look like COVID? Well, Rhinovirus is one of the many viruses that cause colds. So there are about 250 or so different viruses that cause colds. There are 4 coronaviruses, not COVID. There are 4 coronaviruses that cause colds. There are rhinoviruses, there's parainfluenza viruses, there are Kawasakis viruses, there are all kinds of different viruses that can cause cold-like symptoms. You know, rhinovirus, the other coronaviruses and whatever can cause colds, they almost never cause deaths. And that's the difference here. You almost never get them into the hospital for a rhinovirus infection. You almost never get them into the hospital for one of the other coronavirus infections. But in this one, about 5 to 10% of the people who have the disease do get admitted, and about 1% of the people who get this infection die. Many, 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 many times more deadly than the typical rhinovirus. Now, we do think many of the people have a very mild case of coronavirus or an asymptomatic case. Actually does look like a rhinovirus. But rhinoviruses and coronaviruses are structurally quite different. Yeah, so Debbie said, I read that COVID in kids can manifest as Kawasakis disease. If a child has had Kawasakis, could they be immune to some degree? And we don't actually know. So Kawasakis disease is a disease that's been around for years and years and years, described by Dr. Kawasaki in Japan. And it is a disease where kids, who are otherwise healthy, may have had a little bit of cold or something, come up with these symptoms where they have this extremely high fever, really blistery red lips, and a tongue that truly looks like a ripe strawberry. You know, with those pits on it and that bright red thing, really red eyes, and phenomenally irritable. We have not known what causes Kawasaki's. And just amazingly enough, right before this all started, I was at a conference on Kawasaki's, and it was like, you know, we've been doing this for 30 years. We know it comes in this little ups and downs, suggesting it may be related to a virus, but we don't know what in the world virus it's related to. And so it's a problem. Then we started seeing this disease in kids, which is multi-system inflammatory condition in children, syndrome in children, MIS-C, to confuse you with more acronyms. That looks a lot like Kawasaki's. It had fever, they had rashes, they had red eyes, they had heart problems like you had with Kawasaki's. This was actually not a direct effect, we think, of the COVID, but was something that happened later as an errant immune response. And so we may learn from this that the Kawasaki's we've been seeing for years and years and years was the errant response to a different virus. And maybe we'll be able to find that it was one of the other coronaviruses. So we don't know what this is. There are so few kids that have had Kawasaki's disease that I'm not sure that it's going to provide any protection. In all the years I've been doing pediatrics, I've only seen 3 or 4. Yeah. So Ralph says the first case in the U.S. of a COVID patient reinfection was reported this evening as a different strain of COVID and more severe. Do you think a vaccine might be effective against both strains? I don't know the answers to that. I'm not sure that anybody knows the answer to that. So, we've had people who've had COVID, have had a positive RNA test, seem to get better, and then have another positive RNA test later on. The problem on those is it's been hard to know whether you really had the RNA all along and you just didn't catch it for a while, and was it really just lingering virus. And the only way to know for sure would be to capture the actual virus and grow it and know what the genome is the first time, and then capture it again and know what the genome is the second time. So and most people don't have that done. So most people just have the RNA test, but there are a number of people out there who actually did have their virus fully characterized. And so the first one was in Hong Kong. A guy who was sick with COVID had his virus fully characterized. 4.5 months later, he comes back from Spain after a trip. Otherwise, well, not symptomatic at all, but they test him, find out he's positive, they characterize that virus and say, wait a minute, these are different viruses. And as different viruses, this suggests that this was a secondary infection. And it sounds like this is the same case today. I don't know what this means for vaccines. I think we all have kind of thought that a COVID infection will protect you for a few months. But I don't think anybody is thinking that it's going to give you lifelong protection like you get with measles or hepatitis B. All right. Well, we did have a few technical hurdles tonight, but the power is back on. It is a beautiful evening in Roseburg, and hopefully you enjoyed what we did tonight. We'll go do it again next Tuesday, but thank you all for joining us. Again, Dr. Bob Dannenhoffer, Public Health Officer in Douglas County. Thanks.